A new law went into effect back in July 1st exactly, requiring hospitals to report fatal drug overdoses to the police.
This comes as suspected overdose deaths continue to rise across our state and the country.
As State Capitol reporter Chris O'Brien found, the law can be confusing to some at first, though most agree it's a good one.
On the east side of the Cumberland River in Nashville sits the oldest rehab center in Tennessee.
We've been here since 1964, right here in this same location in East Nashville.
Samaritan Recovery Community typically sees people who are struggling with problems beyond just addiction.
About 70% of our patients fall under the classification of indigent.
Indigent is another word for very impoverished, and a new Tennessee law went into effect July 1st that will affect the population of people like the ones at Samaritan.
The bill is very well-meaning in that it's designed so that law enforcement can find out where there are pockets of overdoses that are happening.
The legislation is fairly simple. Hospitals have already had to report deaths from poison or suffocation to law enforcement. This new law adds the words fatal drug overdose to that list.
When a drug overdose comes into the emergency room or the hospital, they need to be able to know who supplied that drug to that individual.
The Tennessee legislature voted unanimously to enact the law.
Ayes 94, no nays.
Which Senator Hensley sponsored. But it took a few rounds of voting to get there because the law was originally written to make it so that hospitals would report all overdoses, not just fatal ones.
So there was concern with that aspect that people might not go, but then we changed it to fatal drug overdose so that narrowed it down considerably.
Dr. Lasco does worry the new law might stop people from getting treatment because they think they might get arrested.
There's no reason not to send someone to the emergency room if there's an overdose.
Though he says he supports it wholeheartedly, as it could help remove dangerous drugs from our streets. In Nashville, Chris O'Brien.
The Tennessee Department of Health has a drug overdose dashboard. Its most recent data is from 2020 and shows that we had more than 3,000 overdose deaths that year. In 2019, there were about 2,000.